I'm about to show you something that changes everything you think you know about high blood pressure. Something your doctor has never told you. Something that finally explains why nothing you've tried has actually worked. I'm Dr. Megan Foster, and after 24 years in clinical practice, I've watched thousands of people struggle with blood pressure numbers that won't budge no matter what they do. They cut salt, they take their pills religiously, they walk every single day, and still the numbers stay high. Still, the fear keeps growing. Still, they're told they need more medication, tighter targets, constant monitoring. And nobody, not one doctor, ever really explains why this keeps happening. Here's what I discovered after 2 decades of seeing this exact pattern repeat over and over in clinic after clinic. The entire way we've been taught to think about blood pressure is wrong. It's not what you think it is. It's not about the things you've been told to fix. And that's precisely why nothing has worked, because you've been fighting the wrong battle all along. In the next few minutes, I'm going to explain what high blood pressure actually is at a deeper level that most doctors never get taught in training. I'm going to show you clearly why the standard approach so often fails people like you. And I'm going to give you a completely different framework, one that actually makes sense of what's really happening inside your body, and more importantly, what genuinely helps move things in the right direction. This isn't another lecture about salt or stress. This is different. Stay with me. Before we go any further, I need to say this clearly and upfront. I'm a physician, but I'm not your physician. Nothing in this video is medical advice tailored to your specific situation. If you're currently on blood pressure medication, if you have heart disease, kidney disease, diabetes, or any other serious condition, you absolutely need to work directly with your own healthcare provider. Do not stop or change any medications based on anything you hear today. This is education and context only. Your individual care must always stay between you and your doctor. That said, everything I'm sharing today is grounded in solid clinical research, randomized controlled trials, and our current understanding of cardiovascular physiology. And I truly believe it's going to help you finally make sense of what's going on in your body. Here's the thing most people are never told. The problem with high blood pressure isn't just the number flashing on the monitor, it's how your body is regulating pressure over time, moment by moment, hour by hour. Blood pressure is not a fixed, static thing. It's dynamic. It moves throughout the day in response to what you eat, how you move, how you breathe, whether you're stressed or calm, whether you're awake or asleep. And that variability, those natural ups and downs, those spikes and dips, that's what matters most. A single reading taken in a doctor's office tells almost none of the full story. What we're really looking at is whether your cardiovascular system can regulate pressure smoothly and calmly, or whether it's constantly overreacting, constantly spiking too high, constantly running elevated even when it doesn't need to. And that's the key insight that everything we're going to talk about today rests on. We're not just trying to force a number down for a snapshot moment. We're trying to support the entire system that controls blood pressure in the first place. Now, what does that actually mean for you in real life? What can you realistically expect if you start thinking about blood pressure this way? First, more stable readings. You're no longer chasing numbers that bounce wildly all over the place. You start seeing real consistency. Second, fewer scary spikes. Those terrifying moments when you check your pressure and it's suddenly 160/95 and your heart sinks start happening much less often. Third, less anxiety every time you wrap the cuff around your arm. You're not treating every single reading like a final verdict anymore. You begin to understand what's normal fluctuation, what's just noise, and what actually needs your attention. Fourth, better tolerance of everyday stress. Your body doesn't overreact as dramatically. You get cut off in traffic or have a difficult conversation, and your pressure doesn't skyrocket the way it used to. And fifth, real confidence. Not in the latest influencer trend or panic-driven advice you see online, but in strategies that are backed by solid evidence and that produce genuine clinical outcomes in real people just like you. I want to be very clear about the tone of everything I'm going to share today. What I'm offering is practical, it's gradual, it's protective, I'm not going to tell you that you can reverse hypertension in 30 days or that you should throw away your medications or that there's one magic food that fixes everything. That's not how the body actually works. But what I'm going to tell you is that there are specific evidence-based strategies that genuinely help your body regulate blood pressure more effectively. And these are things you can actually do in your real life. Let me give you some context about where all of this comes from. Over more than 2 decades of clinical practice, I've worked with thousands of patients who have high blood pressure. And so many of them come in already doing everything right. They're eating salads, they're walking every day, they've cut out salt, they're taking their medications exactly as prescribed, and yet their blood pressure still isn't where they want it to be. Or it's technically controlled, but they feel terrible. Dizzy, tired, foggy-headed, unable to think clearly, and nobody's explaining why. That gap, that painful disconnect between real effort and disappointing outcome, that's what I want to close for you today. Because when you finally understand how blood pressure regulation actually works at a physiological level, you stop spinning your wheels. You stop wasting energy on things that don't move the needle, and you start focusing on what truly does. All right, let's talk about the first big piece of this puzzle: vascular flexibility. Your arteries are not rigid pipes. I know that's the mental image a lot of people carry around, that blood pressure goes up and it's like turning up the water pressure in a hard metal pipe. But that's not accurate at all. Your arteries are living tissue. They're made of smooth muscle. They're lined with a delicate layer of endothelial cells, and they're supposed to be flexible. When your heart beats and sends a powerful surge of blood into your arteries, those arteries are designed to expand slightly to accommodate that surge, then gently recoil. That flexibility cushions the pressure wave and keeps the full force from slamming into your organs with every single heartbeat. But over time, for many of us, the arteries become stiff. They lose that essential flexibility. And when that happens, the exact same amount of blood from the exact same heartbeat now creates higher pressure. Same heart, different vessel response. That's why two people with similar heart function can have very different blood pressure readings. And one person's arteries are still flexible, the other person's are stiff. And stiffness drives up systolic pressure, that top number, in particular. So, what causes arteries to stiffen? A few key things: chronic inflammation, oxidative stress, endothelial dysfunction, high blood sugar over many years, lack of physical activity, smoking, and yes, aging plays a role. But it's not inevitable. There are 70-year-olds walking around with beautifully flexible arteries and 50-year-olds with arteries that feel 20 years older. It depends entirely on how those arteries have been treated over the years. And here's the really good news: vascular flexibility can improve. It's not a one-way street. There are interventions that genuinely help arteries become more compliant again. Let me give you a real example from my own practice. I had a patient in her mid-60s, a retired teacher, who came in with blood pressure consistently running around 150 over 90. Not severe, but not where we wanted it. She was already on medication. Her diet was already pretty good. Low sodium, lots of vegetables. But she wasn't moving much because of long-standing knee pain, and she'd simply fallen out of the habit of exercise. We started very simply. Just 15 minutes of easy walking after breakfast and another 15 minutes after dinner. Nothing intense, just consistent, gentle movement. Within 3 months, her systolic pressure had dropped by 12 points. We didn't change her medication. We didn't do a massive diet overhaul. Her arteries simply started responding better. Same heart, same blood volume, but the vessels were now handling the surge more smoothly. And that's exactly what happens when you improve vascular flexibility. So what actually helps with vascular flexibility? Exercise is probably the most powerful tool we have. And it doesn't have to be extreme. Moderate intensity aerobic exercise, the kind where you can still hold a full conversation but you're breathing a little harder, stimulates nitric oxide production in the endothelium. Nitric oxide is a signaling molecule that tells blood vessels to relax. It improves blood flow, reduces stiffness, and over time it actually remodels the arterial wall in a healthier direction. Studies show that even short bouts of exercise, just 10 to 15 minutes at a time, have measurable positive effects on blood pressure and vessel health. You don't need to run marathons, you need consistency. Potassium also plays a major role here. Potassium helps balance sodium, yes, but it also directly affects vascular smooth muscle tone. When you have adequate potassium, your blood vessels are more responsive and more able to dilate when they need to. Most people don't get nearly enough. The recommended intake is around 4,700 milligallons a day, and most adults get maybe half that. You get it from whole foods, fruits, vegetables, beans, potatoes, fish. Not supplements unless your doctor specifically recommends them, because potassium supplements can be risky if you have kidney issues or you're on certain medications. And then there's the element of time. Vascular remodeling doesn't happen overnight. If your arteries have been stiff for years, they're not going to become flexible again in 2 weeks. It takes months. But that timeline actually matters because it gives you permission to be patient. You're not failing if your blood pressure doesn't drop immediately. You're building a strong, lasting foundation. Now let's talk about sodium. And I'm going to say something that might surprise you after everything you've heard for years. Sodium is not the enemy. I know that goes against almost every headline and every piece of advice you've ever received. Cut salt, lower your blood pressure, end of story. And yes, for some people, sodium restriction really does help. But not everyone is equally sodium sensitive. There are people who can eat a fairly high sodium diet and their blood pressure barely moves. And there are others who cut sodium to almost nothing and still struggle to get control. So, what's the real difference? Sodium sensitivity is influenced by genetics, by kidney function, by insulin levels, by the gut microbiome. A whole bunch of factors we're still figuring out. But here's what we do know with certainty. The ratio of potassium to sodium matters far more than sodium alone. If you're eating a lot of sodium, but you're also getting a lot of potassium, your body handles it much better. Your kidneys can excrete the excess sodium more efficiently, and your blood vessels don't constrict as aggressively in response. But if you're eating a lot of sodium and very little potassium, that's when problems really start to build. And that's exactly the pattern built into most processed foods. High sodium, almost no potassium, packaged snacks, frozen meals, restaurant food, fast food, huge sodium load with virtually nothing to balance it. So when I talk to patients about sodium now, I don't usually tell them to eliminate salt completely. I tell them to think carefully about where their sodium is coming from. Are you lightly salting your home-cooked vegetables? That's probably fine for most people. Are you eating out 5 times a week, having chips, deli meats, canned soups? That's a very different story. The goal isn't zero sodium. The goal is a reasonable sodium intake in the context of a potassium-rich diet. And for most people, that simply means cooking more at home and eating more whole foods. Not because salt itself is evil, but because processed food is nutritionally imbalanced in a way that quietly drives pressure up. Let me share another real clinical example. I worked with a guy in his 50s, a truck driver, whose blood pressure had been creeping up over the years until we finally started medication. He was absolutely convinced salt was the problem, so he went extreme. He cut it out completely, stopped salting anything, avoided anything with sodium on the label, and his blood pressure didn't improve at all. He came back frustrated, feeling like he'd done everything possible and it still hadn't worked. So we looked at his overall diet more closely. He was eating a lot of low-sodium processed food, low-sodium crackers, low-sodium frozen dinners, but still almost no vegetables, no fruit, no beans. His potassium intake was extremely low. So we shifted the focus, added a banana and some spinach to his breakfast, added a sweet potato and some broccoli to his dinner, kept his sodium intake reasonable. Not excessive, but not ultra-restrictive. Within 6 weeks, his blood pressure started coming down. Not because we cut sodium even further, but because we finally balanced the system. There's another piece of this puzzle that most people are never told about, and it's huge. Stress and nervous system load. You can have a perfect diet, you can exercise every day, but if your nervous system is stuck in fight or flight mode most of the time, your blood pressure is going to stay high. Here's why. Your autonomic nervous system has two main branches. The sympathetic branch, which is your stress response. It raises heart rate, constricts blood vessels, increases blood pressure. That's useful if you're actually running from danger, And the parasympathetic branch, which is your rest and recovery response, it slows heart rate, relaxes vessels, lowers pressure. But if your sympathetic nervous system is chronically activated because you're stressed at work, not sleeping well, anxious all the time, your blood pressure stays elevated even when you're sitting on the couch watching TV. And this is where so many people get stuck. They're doing all the physical things, diet, exercise, but they're not addressing the nervous system piece, and that piece is enormous. There are studies using ambulatory blood pressure monitoring, where people wear a cuff that measures pressure every 20 or 30 minutes throughout the day and night. And what those studies show is very clear. People with high chronic stress have much more blood pressure variability. They spike higher during the day, they don't dip as much at night, and their overall average pressure is higher. Even if their resting blood pressure in a calm moment looks okay, the moment stress hits, it skyrockets. So what can you actually do about that? A few practical things. First, breathing. Slow, deep breathing powerfully activates the parasympathetic nervous system. It literally signals your body that you're safe right now. There are clinical trials showing that paced breathing, usually around 6 breaths per minute, can lower blood pressure by several points after just a few weeks of daily practice. It doesn't have to be complicated. You don't need an app. You just need to breathe slowly and deliberately. Inhale for about 5 seconds, exhale for 5 seconds, for 5 or 10 minutes a day. That's it. Second, sleep. Poor sleep drives sympathetic activation. If you're not getting enough sleep, or if your sleep is fragmented, your body stays in a higher alert state, and that raises blood pressure. There's actually a term for it: non-dipping. Normally, blood pressure should drop by 10 to 20% during sleep. That's called dipping. But some people don't dip. Their nighttime pressure stays almost as high as their daytime pressure, and non-dipping is associated with much worse cardiovascular outcomes. It means your body isn't recovering properly overnight. So, improving sleep quality, whether through better sleep hygiene, addressing sleep apnea, or managing insomnia, is one of the most powerful blood pressure interventions there is. Third, managing chronic stress. I'm not going to pretend you can just eliminate stress from your life. That's not realistic. But you can change how your body responds to it. Regular physical activity helps, social connection helps, time in nature helps, therapy or counseling can help if you're dealing with anxiety or unresolved trauma. The point is not to avoid stress completely. The point is to give your nervous system regular chances to reset, to spend more time in parasympathetic mode so it's not constantly running hot. Now let's talk about movement again, but in a very specific way, because I think a lot of people who exercise for blood pressure picture intense workouts. And that's not what the research shows is most effective. What the research shows is that timing and consistency matter more than intensity. Short walks, 10 to 15 minutes, reduce systolic blood pressure, especially if you do them after meals or in the evening. Why does this work so well? Because movement helps regulate blood sugar. And blood sugar directly affects blood pressure. When you eat, your blood sugar rises. If it rises too much or stays elevated too long, it triggers insulin release. And insulin causes the kidneys to retain sodium. More sodium retention means more fluid in your bloodstream, which raises blood pressure. But if you move after eating, even just a gentle walk, your muscles take up glucose without needing as much insulin. Blood sugar stays more stable, insulin stays lower, and you avoid that sodium retention spike. There's a study that looked at this specifically. They had people with elevated blood pressure walk for just 10 minutes after each meal. No other changes at all. And over the course of a few weeks, their systolic blood pressure dropped by an average of 7 points. That's comparable to what we sometimes see from adding a medication, and it's from 10-minute walks. Not boot camp, not running, just walking. Evening walks seem to have an extra particular benefit. There's something about moving in the early evening, maybe an hour or two before bed, that improves nighttime blood pressure. It helps with that dipping pattern I mentioned earlier. Your body enters sleep in a calmer state, and your blood pressure drops more like it's supposed to. I've seen this clinically over and over. Patients who start taking an evening walk, even if they're already exercising in the morning, often see their nighttime blood pressure improve and they sleep better too. which compounds the benefit. So, if you're thinking about what to do differently starting today, this is one of the easiest wins: a short walk after dinner. You don't need special shoes, you don't need a gym, you don't need to carve out a big chunk of time, just 10 or 15 minutes, ideally most days of the week. The consistency is what matters. Your body learns to expect it, and it starts to respond. Let's move to meal timing because this is another one of those hidden factors that almost nobody talks about. When you eat matters for blood pressure, not just what you eat, but when. And the reason has to do with circadian rhythms and insulin sensitivity. Your body is much more insulin sensitive earlier in the day. That means the same meal eaten at breakfast or lunch requires less insulin to process than the same meal eaten at dinner or later at night. And remember, insulin causes sodium retention. So eating late, especially large or carbohydrate-heavy meals late, drives insulin up at a time when your body is already shifting into nighttime physiology, and that raises overnight blood pressure. There's research using continuous glucose monitors and ambulatory blood pressure monitors that shows this very clearly. People who eat dinner late or who snack heavily in the evening have higher nighttime blood pressure. They also have more blood pressure variability. Their body is trying to digest food and regulate blood sugar at a time when it's supposed to be winding down, and the result is poor blood pressure control overnight. Whereas people who finish eating earlier, say by 7 or 8 p.m., have lower nighttime pressure and much better dipping. Now I know this is hard. Modern life doesn't make it easy to eat early. People get home late, they're tired, dinner gets pushed back. But even small shifts help. If you're currently eating at 9 p.m., try for 8:30. Then 8. You don't have to be perfect, you're just aiming for earlier rather than later most nights. And if you do eat late occasionally, don't panic. It's the pattern that matters, not one single meal. There's also the question of meal size. Large meals, especially large dinners, are harder for your body to process. They require more insulin, they raise blood sugar more, and they can trigger a stress response. Smaller, more frequent meals tend to keep blood sugar and insulin more stable throughout the day, which helps blood pressure. But again, this has to fit your life. If eating smaller meals feels restrictive or stressful, it's not worth forcing. The goal is to find a pattern that supports your physiology without creating new problems. All right, now we need to talk about alcohol. And I know this is one people don't always want to hear, but the evidence is really clear and consistent. Alcohol raises blood pressure, even at moderate levels. We're not just talking about heavy drinking, we're talking about 2 drinks a day, sometimes even 1 drink a day, depending on the person. And the effect is particularly pronounced on nighttime blood pressure. You might have a glass of wine with dinner, you feel relaxed, you go to bed, and you assume everything's fine. But what's happening overnight is that your blood pressure isn't dipping the way it should. Alcohol disrupts sleep architecture, it fragments your sleep, it increases sympathetic nervous system activity in the second half of the night, and all of that keeps blood pressure elevated. There are studies that have looked at people who drink regularly and then stop, even temporarily, and their blood pressure drops within days, not weeks, not months. Days. For some people, cutting out alcohol entirely is one of the most effective blood pressure interventions they can make. And I'm not here to tell you that you should never drink. That's a personal choice. But if you have high blood pressure and you're drinking regularly, even moderately, it's worth knowing that it's likely contributing. And if you're willing to experiment, try going without alcohol for 2 or 3 weeks and see what happens to your blood pressure. You might be surprised. Now let's talk about medications because I think there's a lot of confusion and fear around this topic. First, taking blood pressure medication is not a failure. It's not a sign that you didn't try hard enough or that you're broken. For some people, lifestyle changes alone are enough to control blood pressure. For other people, they're not, and that's okay. Medications can be life-saving. They reduce the risk of stroke, heart attack, heart failure, kidney disease. They protect your organs, and if you need them, you should take them. But here's the part that I think gets missed far too often. Medications need to be tailored to the individual. What works for one person might not work for another. And more importantly, overtreatment is a real risk, especially in older adults. There's this widespread idea that lower is always better. that we should push blood pressure down as far as possible. But that's not true for everyone. If your blood pressure is too low, you can have real problems: dizziness, falls, fractures, fatigue, poor concentration, kidney dysfunction. And for older adults, the risks of overtreatment can actually outweigh the benefits. There was a major trial called SPRINT that looked at intensive blood pressure lowering, targeting systolic pressure below 120. And yes, it showed benefits for certain high-risk patients. But it also showed increased risks of hypotension, syncope, electrolyte abnormalities, and acute kidney injury. And importantly, the trial excluded people over 80, people with diabetes, people with prior stroke, and people who were frail. So the results don't necessarily apply to everyone. Yet the message that got out to the public was that lower is always better. And that's led to a lot of people being overtreated. So what does this mean for you? It means that if you're on the blood pressure medication and you're feeling terrible, dizzy, exhausted, can't think straight, you need to talk to your doctor. Your blood pressure might be too low for you. If you're checking your pressure at home and it's consistently running in the 90s over 60s or the low 100s over 60s and you're having symptoms, that's a conversation worth having. Medications can be adjusted, doses can be lowered. Sometimes medications can even be stopped, especially if you've made significant lifestyle changes. But you have to do that with your doctor, not on your own. Stopping blood pressure medication abruptly can cause rebound hypertension, where your pressure spikes dangerously high. So it has to be done gradually and carefully. And here's the other thing. Monitoring symptoms is just as important as monitoring numbers. How do you feel? Can you stand up without getting dizzy? Can you think clearly? Can you exercise without feeling wiped out? Those are real markers of whether your treatment is appropriate. Numbers matter, but they're not the only thing that matters. Let me give you a clinical story that illustrates this perfectly. I had a patient in her late 70s who'd been on 3 blood pressure medications for years. Her pressure in the office was always well controlled, usually around 110 over 65. But she was miserable. She was dizzy every time she stood up. She was falling. She'd fractured her wrist from a fall the year before. She was scared to leave the house because she didn't trust her balance anymore. And nobody had questioned whether her blood pressure was too low for her age and situation. So we did some home monitoring. Her morning pressures were in the 90s over 50s. That's too low for someone her age. We started reducing her medications one at a time, very slowly. It took a few months to get the balance right, but by the end she was on just 1 medication instead of 3. Her blood pressure was running around 130 over 70, and she felt like a different person. No more dizziness, no more falls. She could walk around her neighborhood again, and her cardiovascular risk was still well managed. We didn't need to push her pressure down to 110. That was actually harming her. So the takeaway here is that medication management needs to be individualized. It needs to consider your age, your other health conditions, your symptoms, your functional status. And it needs to be a real conversation, not a dictate. There's one more habit that quietly raises blood pressure overnight, and a lot of people don't even think about it. Late night screen time. Blue light exposure in the evening suppresses melatonin. Melatonin is not just a sleep hormone. It also has cardiovascular effects. It helps regulate blood pressure. It has antioxidant properties. It supports vascular health. When you suppress melatonin by staring at screens late into the night, you're disrupting your circadian rhythm. You're interfering with your body's natural nighttime blood pressure dip. And you're making it harder for your cardiovascular system to recover overnight. There are studies showing that people who use screens heavily in the hour or two before bed have higher nighttime blood pressure and more sleep disturbances. And it's not just about sleep duration. It's about sleep quality and about the hormonal signals your body is receiving. So if you're struggling with blood pressure and you're on your phone or computer until you fall asleep, that's something to address. Dim the lights in the evening. Turn off screens an hour before bed if you can. If you can't, at least use blue light filters. Give your body a chance to produce melatonin and shift into nighttime physiology properly. Now I want to circle back to the big insight I mentioned at the very beginning. Blood pressure is not about forcing numbers down. It's about supporting how your body regulates pressure. Every single thing we've talked about today, vascular flexibility, potassium sodium balance, nervous system regulation, meal timing, movement, alcohol, medication management, all of it is about giving your cardiovascular system what it needs to function well. You're not fighting against your body, you're working with it. And that shift in mindset is huge, because when you're just trying to force a number down, it feels like a constant battle. You're checking your pressure obsessively. You're panicking when it's high. You're restricting and controlling and stressing. But when you understand that your body wants to regulate blood pressure effectively and that your job is to support that process, it feels completely different. You're not at war. You're taking care of a system. So let's talk about what this looks like in practice. What can you actually do starting today? First, pick one thing. Don't try to overhaul everything at once. That's overwhelming and it usually doesn't stick. Pick one thing from this conversation that resonates with you most. Maybe it's a short walk after dinner. Maybe it's finishing dinner earlier. Maybe it's cutting back on alcohol for a few weeks to see what happens. Maybe it's working on sleep. Whatever it is, start there. Do it consistently for a few weeks. See how your body responds and then add something else. Second, track your blood pressure, but do it smart. Check it at the same time of day in the same conditions a few times a week. Not every hour, not every time you feel anxious. You're looking for patterns, not individual readings. And don't panic over one high reading. Blood pressure spikes. That's normal. It's the overall trend that matters. Third, pay attention to how you feel. Are you less anxious? Are you sleeping better? Do you have more energy? Those are signs that your cardiovascular system is functioning better, even if the numbers haven't changed dramatically yet. And over time, the numbers will follow. But the felt experience is important. And fourth, keep learning. There's so much noise out there about blood pressure. Influencers telling you to eat this, avoid that, take this supplement, try this detox. Most of it is not evidence-based, but there are good resources. If you want to understand blood pressure more deeply, look for information from medical institutions, from researchers, from clinicians who are actually treating patients. Not from people selling products. I also want to mention that I'll be making more videos on specific aspects of blood pressure management. One on walking and blood pressure because there's a lot more to say about timing and intensity and how to make it work for different fitness levels. One on nighttime blood pressure and why it matters so much for long-term outcomes. One on stress versus salt because that's a false dichotomy that confuses a lot of people. And one on why blood pressure fluctuates so much and what's normal versus what's concerning. So if those topics interest you, make sure you subscribe so you don't miss them. I'm trying to create a library of calm, evidence-based, practical health information for people who are tired of being scared and confused. Before we wrap up, I want to say one more thing. If you've been living with high blood pressure for a while, if you've been scared every time you check your numbers, if you felt like you're doing everything right and it's still not enough, I want you to really hear this. You are not broken. Your body is not failing. Blood pressure is complex. It's influenced by genetics, by stress, by sleep, by diet, by movement, by medications, by a dozen other factors. And sometimes it takes time to figure out what combination works for you. But every small change you make that supports your cardiovascular system is worth it. Even if the numbers don't drop immediately, even if it feels slow, you are building a foundation. You are reducing risk. You are taking care of yourself. And that matters. So here's what I want you to take away from this conversation. Blood pressure isn't just a number. It's a reflection of how your entire cardiovascular system is functioning, and you have more influence over that than you might think. Not through panic or restriction or obsessive monitoring, but through understanding, through consistency, through working with your body instead of against it. You can support vascular flexibility. You can balance sodium and potassium. You can calm your nervous system. You can move in ways that help. You can time your meals better. You can improve your sleep. You can make informed choices about alcohol and medications. All of these things matter, and all of these things are within your control. The goal isn't perfection. It's progress. It's feeling safer with your blood pressure instead of terrified of it. It's having more stable readings, fewer scary spikes, more confidence in what you're doing. And it's knowing that you're protecting your long-term health in a way that's sustainable and based on real science, not fear. If you found this helpful, I'd appreciate it if you'd give this video a thumbs up and share it with someone who might need to hear it. There are so many people out there who are scared about their blood pressure, who are getting conflicting advice, who feel lost, and I think conversations like this can really help. So thank you for being here. Thank you for taking the time to learn about your health, and I'll see you in the next video.